Good day to everyone. I am Dr. Pravas Mishra. I am a hemato-oncologist and I am working as a senior director in Hemato-Oncology and BMT at Max Vaishali. So what is BMT? BMT, as it is popularly known, the full form could be bone marrow transplant, but we also nowadays call it blood and marrow transplant to specify that the stem cell source could be from the bone marrow or from the blood. In fact, most of the transplants all over the world are now done from stem cells derived from the blood. We do not use the bone marrow as a source of stem cells in most transplants, except in very young donors where we may not be able to get a peripheral blood stem cell. So what are the indications for a transplant? So the indications for the transplant could be congenital problems like thalassemia and sickle cell disease. It could be acquired non-malignant conditions like aplastic anemia, and finally it could be malignant conditions like various leukemias, myelomas and lymphomas. So what are the various types of transplants that we are talking about? The various types could be an autologous transplant where we are using stem cells from the patient itself. So this is called autologous transplant and is done for conditions like multiple myeloma and lymphoma, where collection of stem cells from the patient prior to giving a very high dose of chemotherapy enables us to conduct a transplant. Now, this may not entirely be curative, but ensures that the disease is controlled in cases of multiple myeloma and also could cure the disease in cases of lymphoma where the disease has relapsed after initial chemotherapy. The second type of transplant is an allogenic transplant where we are getting stem cells from a donor. Now, this donor in most cases would be your own sibling or a brother or sister who is completely matched. In case the sibling is not completely matched and is half matched, then it would be called a haploidentical stem cell transplant. We now have techniques which enable us to use a half matched brother, a sister, or a half matched father, mother, or even your own child in case a fully matched donor is not available. In case we are not having any kind of sibling donor or even a half matched donor, or if the treating physician decides that you have to get a fully matched donor, then we might also be able to get a fully matched donor from elsewhere in the world. So for that, we first do a high resolution HLA typing. This high resolution HLA typing is done either from the blood or by a buccal swab. And once we get the high resolution HLA, we then match it with a computer derived algorithm across various registries in the world. This process generally takes about 24 to 48 hours once we have submitted the HLA report, and then we would be able to tell you whether you have a matched sibling donor or not. How long does one person need to stay during the transplant? So most transplants you would need to stay somewhere between 3 to 4 weeks in a room like this. This room would be isolated from the rest of the hospital. It is HEPA filtered. It would have 2 sets of doors out onto the main transplant wing, and there would be nurses who would be dedicated for the transplant. So you would be having one nurse who would be looking after you all the time. We do encourage one attendant to stay with the patient as well during the whole period of the transplant. And any specific food that we prescribe, yes, we do advise that you must take hygienic food. We would not generally advise that you take uncooked, cut food such as salads and fruits during the time that your blood counts are low. But once your counts have improved, then you would be able to take any foodstuff that you want. You would also be able to take milk products provided that they are pasteurized. And once you have been transplanted and you are fit to be discharged, you would continue to maintain hygienic food habits. You would continue to take pasteurized food products, and for about 5 to 6 months post-transplant, you would avoid crowds, malls, markets, because your immunity is completely low and it would take approximately 6 months for it to start recovering again. Transplant is quite an intensive process, and you're going to be spending 3 to 4 weeks of your time within a room, enclosed in a room for a certain period of time. And it is important that you completely understand each and every nitty-gritty of your transplant and the indications for which the transplant has been done, the process, the side effects and the long-term complications with your physician before you go ahead with the transplant. Thank you.